Hello, and welcome to the School of Nursing, Midwifery and Paramedic Practice. This short presentation will hopefully answer some of your questions and also highlight some of the very distinct features of studying at RGU. This is an exciting time to consider a career in one of these professions. Not only is the picture of health and illness changing, as we've seen very recently, but we're experiencing radical changes in the way that we deliver healthcare as a result. The level of knowledge and skills required by nurses, midwives, and paramedic professionals has never been greater. The wide range of education and development opportunities provided by RGU, School of Nursing, Midwifery, and Paramedic Practice, combines challenge with the reward of doing something truly worthwhile with your career. Supported by a rigorous review of education standards by our professional bodies, our education programmes have vision that will prepare you for a lifelong learning and success in your chosen career path. We're innovative in our approach, with a strong emphasis on practice-based learning in various practical clinical environments, allowing you to apply the theory you learn at university. The School of Nursing, Midwifery and Paramedic Practice is the main provider for undergraduate nursing education for Grampian and Northern Isles. The school is also the main undergraduate midwifery provider for Grampian, Tayside, Highland and the Northern and Western Isles, and provides a significant level of postgraduate education across the whole North region. RGU has a strong health professional educational community and is also the main educational provider within this region for pharmacists and allied health professionals. You'll see on the slide that we have three main courses highlighted. These are nursing, midwifery, and paramedic practice. Each course is studied at degree level, with nursing also being studied at honours level. Uniquely to RGU, nursing also offers an honours level dual registration course. That means you could come out with an honours degree qualified in both adult nursing and mental health nursing, for example. So why study at RGU, you might ask yourself? We have several distinct key defining features on how we deliver education and the courses that we offer. And I've already given you an example of that in relation to the nursing dual registration course. There are 5 main areas I want to go into in more depth. 1 is the overseas opportunities we offer. 2, student support. 3, placement experiences. 4, interprofessional learning. And 5, the ethos or philosophy which influences the course structure and the course delivery. In the culturally diverse world in which we live and work, and because of the globalisation of healthcare delivery, the school has invested for many years, since 2010, in promoting overseas experiences for students. An example of that would be Erasmus exchange experiences with European countries, and also Houston and Tennessee university experiences, where students go across and represent the School of Nursing and Midwifery for 2 weeks. To date, nursing and midwifery students who've been overseas have reported that it has been beneficial to their personal and professional development, and many students return from their experiences more independent, resilient, confident, and receptive to others' viewpoints. As well as creating connections abroad, students state that their exchange experiences have proven to be challenging, exciting, dynamic, and inspirational. Those students who don't manage to go overseas also benefit from the knowledge, enthusiasm, and stories told by the students who return from these visits. In the culturally diverse world in which we live, support and satisfaction is a key area that in the School of Nursing, Midwifery and Paramedic Practice we're often credited for. 100% of students were satisfied with our nursing courses last year in 2019 in the National Student Survey. Nursing, midwifery and paramedic practice are interesting, worthwhile and challenging professions, both academically and clinically. Due to the unusual demands of the courses, the school takes the support of any student joining the school community very seriously. You will be allocated a personal tutor who will give you advice and support through your course, and in addition with excellent systems to support you while you're in practice and clinical placement. So while you're out in a clinical area, you have a mentor, you have a supervisor, and they liaise with your personal tutor back at university as well. Other university support systems are also available to you, but I won't go into them here because they are part of the general information of the university that's available to you. Students of nursing, midwifery and paramedic practice spend a large amount of their programme in various health and social care settings, meeting many members of the public, working shifts. For example, out in the community setting, you can be out in all weathers, hail, rain or shine, visiting numerous homes. It's important that you remain fit and healthy during the course, not only emotionally but also physically, and to that end we also have support available to you via the occupational health services and the school inclusion leads. And the school inclusion leads link with the inclusion centre within the university, so that offers support for people with dyslexia, dyscalculia and so forth. Nursing. Okay, so how will you be taught in RGU? This is at the crux of your educational experience, really. 50% of the course is taught at university, 50% of the course is taught out in a clinical area. A link between the university and the clinical area is very, very strong, and the academic staff regularly with the clinical staff and vice versa. You'll be taught through something called simulation. We have a very good and excellent clinical skills setting that is modern and was built last year, updated last year. In the clinical skills setting, we have various rooms. We have high dependency rooms. We have 6-bedded ward areas. We have children's ward. We have laundry. We have a sluice, so it looks like a hospital setting. We also have a home setting, because very often most of the care that the NHS delivers is delivered in the person's home. So these simulation events are carried out in this clinical skills setting. Simulation events are recorded so that when students are finished, they can see the simulation back and see how they might want to change things, how they might want to improve things. Sometimes simulation is carried out on mannequins, and sometimes we have, or very often, we have volunteer patients, older people, middle-aged people, young people, children, who come in and they act out a kind of role and you respond appropriately. And all of this learning means it doesn't matter if you make mistakes because it's carried out in a safe environment. So that prepares you for when you do go out and you meet people in an environment where the decisions that you make are very, very important. We have what's called blended learning in the university, and we're very, very good at this because we offer a lot of post-registration courses which are all online, when the students don't come into the university at all, apart from probably 1 or 2 days. So undergraduate level, we've taken this knowledge forward and we teach online to a high standard. So you will although you're learning online, you're not just given the information. The situations, the learning is facilitated. You might be put into small groups. You might be given something to work through together in the group, and you come back and you present it. We have a 3D, quite uniquely, a 3D virtual community. So we can all go into this virtual community, and we can all go into somebody's home, and we can look at the family there, and we can decide on the care that's needed. We can decide who's at risk. We can decide what other health professionals need to be involved. All the staff in the university, in the department who will teach you, are also, on top of their professional qualifications, are also qualified teachers as well. So they understand learning, they just understand how to deliver education to you. Okay, so how will you be taught this? So we've talked about how you'll learn in university. You'll all learn together. So many of you, although you're in a class of nursing students, you might well find that you're also learning alongside a paramedic student. Because you're a nursing student, you could either be a mental health nursing student, an adult nursing student, or a children's and young persons nursing student, but you'll all be learning together. You'll be learning from each other, and you'll be understanding and learning the breadth of human experience, not just your specific focus for your role. And that makes you better practitioners. That means you can go out and you can see the whole family, and you can understand the whole family, not just the one with the one condition. It makes you very employable. So we come to the clinical placement now, which is the other 50% of the course. And the clinical placement experience, again at RGU, will allow you to experience and understand the complexities of healthcare provision in a variety of settings. So, for example, you could be in a hospital, but you could also be visiting the prison and seeing how care is carried out there, nursing care is carried out there. And again, as I keep talking about the community setting, because that's where the vast majority of health service delivery is carried out in the community setting. But it's all linked. And what we want you to be able to do when you graduate, no matter what professional group you're part of, is to be able to take the skills that you have and provide efficient, effective care to whoever you are looking after, and know what other professionals to link with, and be flexible and to be adaptable. And it doesn't matter where the patient is, whether they're in a hospital or they're in a home, their condition has to be managed well. RGU also uniquely in Scotland allows you to experience healthcare management and delivery in the city, in the rural situation, and in island populations. Healthcare delivery is quite different in 3 settings. In the city setting, you've got a lot of resources, you've got a lot of facilities, but it's not without its challenges because it's got a lot of demand. In the rural setting, there are other, you probably have fewer resources, but you've got other things to consider. The likelihood of somebody wanting to stay at home to be looked after is much higher. The likelihood of the person having depression or having alcohol dependency is actually much higher. People are much more isolated. They're much more likely to be cut off. The resources aren't there, as I said. And things such as even transport can make a huge difference. And this is where the use of technology in healthcare delivery is really important, and it has a very strong emphasis in our curriculum. In the island populations, again, very different settings for healthcare provision, and many of our students who go up to Orkney or Shetland or the Western Isles really, really, really enjoy those experiences. You'll be allocated placement experiences in the professional field, the profession and the field you're choosing to study. But importantly, you'll also spend time participating in care delivery in an alternative field. So, for example, again, back to nursing, if you are studying children's nursing, You will have experience in children's clinical settings. You may well also have either an adult setting or a mental health setting, again to give you a breadth of education. And finally, what I really want to emphasise to you is one, our resources are excellent. Two, expertise is excellent. Three, there are strong links between the university and the health services, and not just the health services in Grampian, but the Highlands and Islands and Tayside and various other areas as well. We have a strong research focus in the university, and we have a strong research focus in the School of Nursing. So we are contemporary. We deliver not just undergraduate education, but postgraduate education up to PhD level. So we understand the trajectory of your career, your possible career. We want students to learn together from each other and really understand healthcare provision, not just the small role that you'll play in it, but the overall picture of it. The one thing I haven't mentioned so far is interprofessional learning. I talked about the fact that you'll learn from your colleagues in RGU, but every health and social care student in RGU, so that's physiotherapy, social work, occupational health, will link up with the students who are studying equivalent courses, for example, medicine, etc., at Aberdeen University. And through our interprofessional learning programme, which runs for the 3 years, will come out with a full understanding of what everybody's role is and what true teamwork looks like and the importance of it. And as you know, that's really at the crux of healthcare delivery, is communication and teamwork. All staff in the school are committed to your success. And hopefully we look forward to working with you and seeing you in the future. There are some useful links in the following slides, and there are also some interesting videos as well for you to watch. Thank you very much for giving me your time and attention.